What's up, TUMNAD lectures? In this video, I'm taking you through on what we call the summary of the different types of the blood circulation that we looked at in the previous videos in great detail. If you find this video helpful at the end of it all, please make sure to like the video, comment down in the comment section, and please subscribe. Let's go ahead and get started. So now, in the previous videos, we looked at what we call the different types of the blood circulations, what we call the pulmonary circulation, the systemic circulation, and the coronary circulation in great detail. Today we are looking at what we call the summary of each one of them. But before you go into what we call the summary of each one of them, I want you to take a look at what we call the photographic animation, which is going to be showing what we call systemic circulation and then what we call the pulmonary circulation. Take a look at these photographic animations. Now that you have seen the photographic animation showing the pulmonary circulation and then the systemic circulation, let's also take a look at the photographic animation showing what we call the coronary circulation. Let's take a look. Now that we have the basic idea of what's going to be happening, let's go ahead and get started and look at the summary of each one of them in simple summary, okay? We said that we are looking at what we call the pulmonary circulation. Pulmonary circulation is going to be involving the movement of the blood from the right side of the heart to the lungs and then back to the left side of the heart, okay? It's all that simple. Where is it going to be starting? Pulmonary circulation starts from what we call the right ventricle. The right ventricle will squeeze the blood as if they have never squeezed before, and this blood will knock what we call the pulmonary seminal valve open. Once the pulmonary seminal valve opens, the blood will enter into this big kind of the vessel, which we call the pulmonary trunk. What happens that the pulmonary trunk eventually is going to be bifurcating into what we call the right and then the left pulmonary arteries. These kind of the arteries are going to be taking the blood both to the right lung and then to the left lung. Okay. What happens that this kind of the right and then the left pulmonary arteries are also going to be breaking further into other kind of the tiny kind of the vessels, which we call the pulmonary arterioles. And then eventually these pulmonary arterioles are also going to be breaking even more further into other smallest kind of the blood vessels, which we call the pulmonary capillaries. Now, the pulmonary capillaries are going to be providing what we call exchange surfaces. What do I mean by this? It is within this kind of the pulmonary capillaries that you're going to be having now our exchange of what we call the gases. Carbon dioxide is going to be moving over the pulmonary capillaries, and then oxygen is going to be moving into what we call the pulmonary capillaries. What is going to be the driving factor? The partial pressures. Okay? And then from there, after you have had what we call exchange of the gases, you're going to be having now oxygen-rich blood. We shall have what we call post-pulmonary capillary vessels, which we are calling what we call the pulmonary venules. And multiple of the pulmonary venules will come together and make what we call the pulmonary veins. And of course, you're going to be having what we call both the right and then the left pulmonary veins. They're going to be carrying oxygen-rich blood. Now, what happens that these right and then left pulmonary veins, they are going to be dropping this blood into what we call the left atrium. Okay, and then from there we shall have now blood from the left atrium moving through what we call the bicuspid valve, and then it enters what we call the left ventricle. Now, when it reaches the left ventricle, that marks to the end of what we call the pulmonary circulation. Okay, and then the main function of the pulmonary circulation is going to be what we call exchange of the gases. Okay, it's all that simple. We are dropping CO2, we are picking oxygen. Okay. Now, that covers pulmonary circulation. Let's look at what we call the systemic circulation. And when we talk about the systemic circulation, we are moving the blood from the left side of the heart, we push it to the entire body tissues, and then we bring back that blood back into the right side of the heart. Okay? Meaning that it is the following movement of the blood from the heart to the entire body tissues and then back to the heart. That is systemic circulation. Okay? The question is, where is systemic circulation going to be starting from? It's going to be starting from what we call the left ventricle. The left ventricle will contract and squeeze the blood as if they never squeezed before, but this blood will have to knock this kind of valve we are calling the aortic seminal valve. When the aortic seminal valve opens, it will allow the blood to move into the biggest kind of the artery in the human body, which we call the aorta. Okay, what happens that the aorta is going to be having three kind of what we've got what we call the portions. We're going to be having the ascending aorta, the aortic arch, and what we call the descending aorta. These kind of the portion of the aorta are going to be giving off a lot of different kind of the branches. When we look at what we call the aortic arch, we're going to be having three main great vessels which are going to be supplying all the upper extremities. And even also shall have what we call the descending kind of the aorta, which is going to be giving oxygen-rich blood, nutrition-rich blood to the lower extremities. Okay? And then from there, from the aorta, you're going to be having now the small arteries. Because it is not the aorta which reaches the tissues directly. This kind of the aorta will give off small kind of the arteries. And then, of course, this kind of the small arteries will eventually break down into other kind of the small kind of the arteries, which we call the arterioles. Okay, and then from there, these arterioles are also going to be giving off furthermore smallest kind of the branches, which we call the blood capillaries. Now, these kind of the blood capillaries are going to be embedded within what we call the tissues. Okay, that's where you're going to be having exchange of different kind of the substances. For example, you're going to be having a lot of oxygen, you're going to be having a lot of the nutrients coming out of the blood capillaries into the tissues in exchange of what we call the carbon dioxide and even other waste. Okay? And then from there, from the blood capillaries, you now have what we call post blood capillaries vessels, which we are calling the venules. And eventually, the venules are going to be coming together to make what we call systemic veins. Okay? They'll come together and make what we call the systemic veins. And when you talk about the systemic veins, these are going to be the kind of the veins which are going to be draining individual kind of the organs. Like, for example, the renal vein, the hepatic veins. All those are going to be what we call the systemic veins. And eventually, these kind of the veins are also going to be now pouring the blood into the main kind of what we call or the vein which you are calling the vena cava. And of course, the vena cava, you're going to be having two of them. The one draining the upper extremities, we call it the superior vena cava, and then one draining the lower extremities, what we call the inferior vena cava. And eventually, the superior and then inferior vena cava will drive over this blood and then pours into what we call the right atrium. From there, blood from the right atrium will move past what we call the tricuspid valve into what we call the right ventricle. And once this blood reaches the right ventricle, that marks to the end of what we call the systemic circulations. Okay, and the significance of the systemic circulation is going to be supply of oxygen and even also what we call the nutrient to the tissues. Okay, now that we have seen what we call systemic circulation in the simplest summary, let's take a look at what we call the coronary circulation. Now, coronary circulation, we said that this is the type of the circulation which involves supply of oxygen-rich blood to the entire myocardium or the heart muscles. Okay, and this kind of the coronary circulation is only and only going to be happening during ventricular diastole. We're saying that the coronary circulation is starting from what we call the left ventricle. When the left ventricle contracts, it will push this blood bypass what we call the aortic seminal valve into what we call the aorta. This kind of the aorta we are meaning is going to be what we call the ascending aorta. Okay, and then from the ascending aorta, we are going to be seeing now, we are going to be having two main kind of the branches of what we call the coronary arteries. We are going to be having what we call the left coronary artery and then also what we call the right coronary arteries. Now, what happens that the left coronary arteries will give off two kind of the main branches. What are these branches? The first one is going to be what we call the circumflex artery, which is going to be supplying some little part of what we call the left atrium, and then also this kind of the circumflex artery also give off a very kind of the minor kind of the branch which we call the left marginal artery. Super very important. And then another big kind of the branch of the left coronary artery is what we call the left anterior descending artery, or even also can also be called what we call the anterior interventricular artery. This one is the super very important, and in most cases this is the one which is going to be supplying the biggest percentage of what we call the left myocardium. And any kind of the occlusion of this kind of the artery will lead into what we call different kind of heart attacks, and for that reason sometimes named as what we call the widow marker. Okay, so now when we come over to what we call the right coronary artery, it also gives off two main kind of the branches. The first one is what we call the right marginal artery, going to be supplying the different margins of the right side of the heart, and then also what we call the posterior descending artery, which can someone also call what we call the posterior interventricular artery. Okay, so now what happens that all these arteries are going to be supplying different portions of what we call the myocardium. Okay, and then from there it means that you're going to be having now from the right marginal artery you have what we call even arterioles, or okay, then from there from the arterioles into what we call the capillaries. All of them we're going to be having now arterioles, then finally into what we call the capillaries, which are going to be feeding what we call the myocardium. Okay, and then from there we shall have what we call now venules. Okay, of which venules, multiple the venules will come together and make different kind of the veins. Now the question is, those areas supplied by what you call right marginal artery are going to be drained by what you call small cardiac vein. Okay, it's all that simple. And those areas that supplied by what we call the posterior descending artery will be drained by what we call the middle cardiac vein. Okay, and even also those areas supplied by what we call left anterior descending artery will be drained by what we call great cardiac vein. And then lastly, those areas supplied by what we call the circumflex artery will be drained by what we call the posterior vein of the left ventricle. Okay, it makes a lot of sense. And eventually, all of these veins will come together and then they pour a specific kind of the vessel which we are calling the coronary sinus. And this coronary sinus is going to be pouring all this blood into what we call the right atrium. Okay, and once the blood reaches what we call the right atrium, past all this kind of the myocardium, we say that marks the end of what we call the coronary circulation. And the significance of the coronary circulation is to feed oxygen-rich blood, nutritious-rich blood to the entire myocardium. Okay. So now, that briefly covers the summary of pulmonary circulation, systemic circulation, and what we call coronary circulation. Now, in the next video, we are going to go into now other kind of the blood circulation. So look at what we call the microcirculations, and even also so look at what we call the sac of wheels circulations. Okay. Thank you very much for watching, and if you think whatever I have talked is making sense, is adding to you, you're benefiting, please hit like button, comment down in the comment section, and please subscribe as always to TUMNAD until we meet next time.